Welcome to the September 17th meeting of the Probus Club of Burlington. This is our third meeting being held by Zoom, and unfortunately we had a couple of forgivable glitches, but overall we've had some very good comments. And once again, due to the COVID challenge, we can't meet physically, so the next best thing is this is appropriate in a safe format available to us, and thank goodness for that. We don't have physical greeters today to shake your hand when you logged on, but we do want to acknowledge Bob Dickinson and Gary Hindley, who are here to help set us up for the meeting and available throughout the meeting. At this time, I want to relate a story that may be of interest to some of you. A man named Michael called his son, "Kevin, I have news to tell you. I know it's going to upset you, but I've made up my mind and there's nothing you or your siblings can do about it. I've decided to divorce your mother." "But Dad, how can that be?" the son asked. "You've been married for over 40 years and you've always seemed to get along and be happy. What happened so suddenly?" "Son, I've made up my mind and I don't want you to try to convince me out of it." "Okay," the son responded, "but promise me you won't do anything until I come and talk to you in person, and I'm going to ask all of my siblings to fly in as well." "All right," said the father, hanging up. "You have my word." "Well," said Michael, turning to his wife, "I got them all to come in, and I didn't even have to pay for their tickets." I'm glad it's on mute because I don't know if anyone appreciates those or not. So you can clap if you appreciate it. Thank you. I want to remind you that almost all of our regular activities have been canceled for the balance of the year, and this includes our annual Christmas event. Our computer interest group, however, is resuming meetings via Zoom next Thursday, the 24th at 10 a.m. If anyone is interested in joining this meeting, you can send an email to membership@probusclubofburlington.ca and you will be contacted with the Zoom link details. So that's membership@probusclubofburlington.ca. Fairly simple. In answer to our polling question last month, a large majority asked to hold a monthly meeting in December this year. You may recall that in the past, we haven't held December meetings because the third Thursday in December comes very close to Christmas and the Christmas festivities. Your executive team has decided to have it scheduled for Thursday, December 17th, and prior notification will obviously be sent out in due course. Gladly, I've received no reports of members' illnesses, maybe some aches and pains for some of us. And there are no inductions today for new members. I want to remind everyone that we are still accepting applications for new members. You can contact our membership chairman, Bob Dickinson, and Bob can be reached through our website. We also urge you to invite any of your friends to come along to any of the upkeeping meetings as a guest, as introduction to our club. You can pass along the link to them, but would like to know their name in advance of the meeting so that they can be introduced and recognized to the attendees. I will now turn the meeting over to Dan Gallagher to introduce today's dynamic speaker, Dr. Erhard Bussi.
Okay. Good morning, everyone. It is my honor and it's my pleasure to introduce you to Dr. Erhard Bussi. No doubt you have all read about his qualifications and his career in the recent Probus newsletter. So just very briefly, Dr. Bussi is renowned and distinguished in the field of psychiatry, also children's mental health, mentally disordered criminal offenders, He's got a long career in hospital senior management, including chief of medical staff at the Oakville Trafalgar Hospital. He's also a consultant to the insurance carriers, and not to mention that he has his own private practice, which he still has. And Dr. Busi also has given lectures all over the world. And I might mention that he was a captain in the Canadian Army. So without further ado, I'd like to hand this over to Dr. Busi for a most interesting and fascinating presentation. Thank you.
Take yourself off mute.
Yeah, okay. Can you hear me now?
Yes.
Okay. Thank you for the invitation and the opportunity to share some of my thoughts. I'm talking to an audience that's well past age 21. And as they often say, memory is the second thing to go. So we're going to talk about brain function and keeping it going. All right. My talk will be on neuroscience of the brain, the role of stem cells in regenerating our brains, and talking about some brain myths. To put things in a perspective, I graduated from U of T Medicine in 1966 when we were in a very different era. For instance, when we had to deal with an MI, which is a heart attack, the gospel then was 5 weeks of enforced bed rest. They even had to do the toileting on a bedpan. So when people finally got up and started walking after 5 weeks, they could hardly walk, not because the heart was damaged, but because they were horribly deconditioned. The rule of thumb in conditioning is this: 1 week of no activity takes 2 weeks of activity to recover the function you had before you became inactive. The other thing is hip fractures, hip replacement surgery. And you know that's very, very common because hips hurt when you get old, and many people. The traditional method of doing a hip replacement is to come in from the side of the leg, cut through many muscles, and then put in the prosthesis. And what takes time to heal are the muscles that get cut. Nowadays, there's a new procedure where people come in from the front of the leg. They don't need to cut muscles. They simply spread them apart while they work on putting in the prosthesis. The result is that within days, you are walking rather than a prolonged rehab period. So many things have changed, and activity rather than rest is the new reality. We have to remember that for thousands and thousands of years, we were hunter-gatherers. And we were biologically programmed through natural selection to become very, very active people. The other thing that's changed over the centuries is, for instance, when I was a younger guy, I used to read history stories, and I read that Alexander the Great died at about age 35 or thereabouts from a wound infection. They didn't have antibiotics then. And I remember saying, oh, the poor guy, he died so young. He didn't die young. He was an old man. In his era, if you lived past 30, you were an outlier. Another example of that was when my kids were younger, I took them on a trip around the Great Lakes, and we stopped at Fort Williams up in Thunder Bay. And I entered this room where there were all kinds of very small little beds in there. And I said to one of the staffers there, I said, geez, I didn't know they had a pediatric unit up here. They said, no, these are the beds where the coureurs de bois, the canoe paddlers from the Hudson Bay Company slept. They said they rarely lived past 30, and they were very short. They were a little bit over 5 feet. So times have changed. And with all of us now growing to be quite old, well past 65, we have to deal with new realities that were never a matter of concern 50 or 100 years ago. So the big question now is, does the brain regenerate? Because in 66, when I graduated, we were simply told, nope, you're born with so many cells. As you age, you lose them, and eventually you don't have enough left to sustain you. Well, all that's been turned on its head now. We know the brain regenerates, and we know what it takes to make it do that. And that's going to be part of my presentation now. So we're talking about brain plasticity and the beauty of stem cells. Stem cells are those cells which are undifferentiated. In other words, when they get their marching orders, they can become brain cells, heart cells, bones, skin, whatever. So in the very beginning of our lives, when the first spermatozoon slammed into an egg, we had a stem cell. And gradually, as these cells multiplied, they got different marching orders to be ultimately turn us into the complex biological organisms that we people are. We then discovered that in a part of the brain called the hippocampus, where your long-term memory is stored, there are millions and millions of stem cells. And because of that, we now know the brain, if we do the right things, can continue to regenerate. Going back a bit, we had a famous neurosurgeon in Montreal. He was actually an example of reverse brain drain. He was an American who came and settled in Montreal, worked at McGill. And in the early days, this would have been about 100 years ago, neurosurgery often consisted of opening up the skull to get at the brain to find a center causing epilepsy. And if you can, the hope was if you could remove that center, you could cure intractable epilepsy. For the longest time, the operation was performed under general anesthesia until he went to train under a fellow in a German city. Now it's Poland, it was then called Breslau. In any case, the surgeon there operated under local anesthetic because you only have pain receptors in the skin and the periosteum, which is that skin that surrounds bones. And if you can freeze that, you can cut a piece of the skull open and look at the brain. The brain has no pain sensation. And people were fully awake. And so he made deals with this patient. He was saying, well, I'm going to stimulate this or that part of your brain while we're in there, and you can tell me what you think, feel, or what moves. And based on that, brain maps were developed. In other words, we now had a map that said this area controls your left leg, your right leg, etc. And again, when I graduated in '66, that was a given. You have a brain map, and if you wreck part of it, in other words, if you have head trauma or a stroke, that part is gone forever, and that function that was served by that part is gone. Well, not so fast. I remember reading with great amazement a paper in the British Medical Journal in the 80s that looked at diagnostic, meaning X-ray, images of brains of different people. And some people, since a very, very early age, before the brain plates fuse, in other words, when the brain is still able to expand, have hydrocephalus. Hydrocephalus means you make more brain with cerebrospinal fluid than you can get rid of, so there's pressure building up inside your head. And they showed the diagnostic imaging studies of one fellow who had so much fluid in his head, he only had 1.5 inches of brain tissue around the periphery and nothing else. And you would expect, well, this poor fellow is going to be developmentally challenged, what used to be called retarded. But he wasn't. He got a PhD at Oxford, and they don't give you a PhD there because you can't walk. You have to produce and demonstrate proficiency. So all of a sudden, the static models of fixed brain maps are thrown into question. We also are learning these days that we can, if somebody has a stroke, and you may have seen people like that, for instance, where their left arm is sitting in a sling on their left, and it's all puffy because the muscles aren't working, so fluids don't get pumped out of it. And then the corner of their mouth might be drooping with food dripping out when they eat. In other words, a typical stroke victim. And again, we used to say, well, that part of your brain map is gone. The stroke killed the cells because of lack of blood supply. And get used to it, your arm will never work again. Well, not so fast. If you can get the slightest little flicker of movement in that arm, you can now begin to retrain the brain so that another part of the brain can take over the function of controlling your left arm. And we can now regenerate stroke victims, in other words, lost function in the limb, we can bring it back. It's very new. There are some centers who are very good at it. There's one in Birmingham, Alabama, for instance. But it's still working its way through the medical system. But it's great news. We can regenerate function. The dead part of the brain stays dead. But the function it served can be delegated to another part of the brain and take over that function. So great news. For the longest time, we had no idea what goes on in the brain because you couldn't get at it. It was encapsulated in the skull. And so psychiatry got its origins from theories of what we think might happen in the brain. In fact, back in 1854, two very famous men were born. One was born in Vienna. His name was Sigmund Freud. Now, he didn't know what happens in the brain, but he formulated a very complex theory of psychosexual development, what makes you the person you are. But it's a theory. It is not based on facts. Psychiatric diagnosis was a dog's breakfast for decades and decades, depending on who the local opinion leader, the professor was. A middle-aged depression might be called involutional melancholia. You go to the next country and they would call it endogenous depression, and on and on. It was like people that built that biblical tower that spoke different languages, and you couldn't do good research because you were describing different things. So you were comparing apples and oranges. The American Psychiatric Association then started to say, we got to put an end to this. And they developed the DSM system called Diagnostic and Statistical Manual. And it was an effort to make us all talk the same language. And the World Health Organization also did that. They developed a parallel system that wasn't exactly the same, but we finally now had at least 2 languages rather than 20. But we still were stuck with not knowing what happens in the brain. The second guy who was born in 1854 was Emil Kraepelin. He was born into a Prussian accountant and bookkeeping family, so he developed an actuarial model. He basically said, well, if you have a depression, if out of the 9 common symptoms of depression, you have at least 5. Not a single symptom is specific to depression. Every symptom can be caused by 15 or 20 other things, but when a cluster of 5 or more happens at the same time, then you have depression. Again, it's not based on demonstrated functioning, but on a sort of an actuarial model. Then the big miracle came. We developed imaging systems that looked not just at structures like an X-ray, but that looked at functions. In other words, what happens when you're thinking, moving, etc., in the brain. First, we got PET scans, positron emission tomography, and then we got functional MRIs. And we're now at the point where we can tell when you're thinking a thought or carrying out an action, which part of your brain is active and involved in that activity. We're still waiting for a new diagnostic system other than what 2 guys born in 1854 developed in psychiatry. We're not there yet, but I think we're on the cusp. So we now know that we have lots and lots of stem cells in the hippocampus, part of the brain. The question now is, how do you give them marching orders? You know, I'm reminded of cowboy movies when the battle with First Nations folks and the guys in the blue uniform was going badly for the guys in the blue uniform, and then all of a sudden you heard a bugle and the cavalry came and saved the day. Well, the stem cells are the cavalry. But how do we give these stem cells marching orders? Well, we have learned you've got to use your brain. And of course, all of you who've joined Probus have done so in part to learn things, to listen to things. You're using your brain. The more interests you have, in other words, the more activities that require some utilization of brain, the better for your brain. But using it alone is not enough to give these stem cells marching orders. You also have to have passion. In other words, do what you're passionate about, do what you love doing. Sweeping the floor in a factory is not going to do it. But learning new things and having a diversity of interests, that's what keeps your brain young and functioning. It does not prevent such things as Alzheimer's or various neurodegenerative diseases. So it's not a cure for disease. But most of us don't have those diseases. We simply have normal brains that are aging. And by staying active, having interest and pursuing them with passion, you keep regenerating your brain. Now, moving on, the second part is brain myths that have been around forever, and they have now been busted by new knowledge. One of them is, how much of our brain do we use? Often I've seen in literature people saying, well, we use about 10% of our brains. The answer is we don't know. We don't know how to even measure that. But we have some interesting tidbits that are leading to new research. For instance, we have people that we call idiot savants. As a little aside, about 100 years ago, when we started measuring IQ, we had to have scientific terms for the people who had 0 to whatever, 0 to 10 and blah, blah, blah. And we developed these highly scientific terms, idiot, moron, and imbecile. Of course, the common language took over those terms and you lost their scientific meaning. So now if you don't like somebody, you call them a moron or an idiot or an imbecile. Then we went on to the next one and saying people were mentally retarded. That's a misnomer too, because retarded means they're delayed, but eventually they'll catch up, or they don't catch up. And again, that got taken over by common usage, and if you didn't like somebody, you might call them a retard. So we abandoned that, and the latest iteration is developmentally challenged. So far, nobody goes around calling people developmentally challenged as a pejorative term. So there are people then called idiots who had very, very low IQ, so low that some of them can't even tie their own shoes. But if you ask them what day of the week was February 3, 1487, they would think for a moment and give you an accurate answer. And you could ask question after question like that, and they would give it to you. They can't tie their shoelaces, but they can do that, which would suggest that we have some hidden powers in our brains somewhere. And there are a number of research studies going on trying to find out how can we tap into that and make all of us smarter. So far, we don't know, so don't hold your breath. The Mozart effect. There was a sort of a story going around for a long time that if you played classical music to developing infants, you would somehow have them develop superior brains. The idea, of course, there's a constant interplay between our brain and the world around us, and our brain adapts to the world around us. But so far, we've seen no evidence that when you play lots of Mozart to your 6 months old infant, and in 20 years, he'll be a genius. It hasn't happened. Adults can't grow new brain cells. That was gospel when I graduated in '66, as I've told you before, and as my prior talk goes to show that's simply not true. We are constantly regenerating brain cells as long as we use our brains with passion. Male brains are biologically better suited for math and science, female brains for empathy. Right and wrong. Our brains are constantly reacting to expectations and the environment around us. So for the longest time, males were favored in education, and so math and science was the direction they went in, and they got better at it. Females were the keepers of the hearth in the home. They nurtured, they loved, they took care, and so their empathy was greater, not because they were born with greater capacity for empathy, but rather they were conforming to cultural norms and expectations. A few more brain myths. Doing crossword puzzles improves memory. Wrong. It only improves the ability to do crossword puzzles. It doesn't generate into all other areas of activity. Students learn best when teaching styles match their learning styles. This was a big thing in the 80s. The scientific literature talked about neuro-linguistic programming without going into a huge explanation. They were saying if people say, yeah, I hear you, this means they were auditory learners. If people said, yeah, I see what you mean, they were visual learners. And so programs were set up for visual learners, for auditory learners, thinking that if you match their learning styles, they would learn better. That has not proven to be true. What makes you learn well is repetition, getting ready for tests, and spacing out learning sessions. Often I'm asked in my professional capacity as a psychiatrist by university students, what's the best way to study? And we know what it is. The human brain is at maximum peak efficiency for about 45 minutes, and then you have diminishing returns. So students who pull all-nighters are really wasting an awful lot of time. The way to study is to study hard for 45 minutes, take a walk, or do something totally different for 15, another 45 minutes, and on it goes. You've got to break it up. Learning has to be spaced out over time. Drinking alcohol kills brain cells. Well, maybe it does, but we don't have scientific proof of that. What we do know, though, is mothers, especially in the first trimester of pregnancy, who drink way too much, they have a negative impact on the developing fetus. And in fact, institutions where you house people who are developmentally challenged have a fair number of people with an fetal alcohol syndrome. They have a low IQ and they have distinct facial features that helps you recognize them. Is ESP a scientific certainty? If you go on YouTube, you watch these magicians on Britain's Got Talent or America's Got Talent, and they do unbelievable things, but they have tricks. It has never been proven that ESP is reality. Some people are left-brained, i.e. logical. Some people are right-brained, i.e. creative. But the evidence for distinct personality types is simply lacking. The right and left brain perform different functions, but you don't really have right and left brain people. If you want to read a small little book that's very, very interesting about that, it's called My Stroke of Insight, where a neuroscientist from Harvard University was taking a shower one day, and this was a very, very bright gal. And while she was showering, her brain function changed, and she realized she was having a stroke. She rushed to the phone to call her colleague to tell him that she was in trouble. And by the time she got to the phone, she lost use of language. She could only make funny animal sounds. Her colleague had called this place, realized who it was, sent an ambulance, and she was taken to hospital. It was found that she had a stroke in the millions and millions of fibers that connect the right brain to the left brain. Those fibers are called the corpus callosum. And she spent a long time accessing only her right brain. And it was a unique experience that's described in this book, My Stroke of Insight. She had no language. She couldn't speak. She had that locked-in syndrome, as it's called. But when somebody entered the room, in no time at all did she feel whether they cared, whether they were just doing a job and couldn't wait to get out of there. These intuitive and pattern recognition ability became highly, highly sensitized because for a period she lived only on the right side of her brain. Over time, the connections regrew, redeveloped, and she again regained full functioning. It took years, but her life changed because what she saw through her right brain influenced her very much. And she paid more attention to quality of life than just working 25 hours a day. So, what are the takeaway points for people our age? Both body and brain benefit from use and activity. We no longer keep heart attack patients on 5 weeks of enforced bed rest. Within days, we have them up and walking, because healing is promoted by activity, not by inactivity. And the same is true, we know now, of the brain. So folks, develop lots of interests that you're passionate about and have a great time with that. That ends my talk now, and I'm happy to respond to any questions you may have.
Okay, so this is the question and answer period. And anyone that has a question for Erhard, please raise your hand, and Gary Hindley will keep track of who you are and introduce you when it's your turn to ask a question. Remember to take yourself off mute when it's your turn to ask a question, and then after you've asked the question, please put yourself on mute and Erhard will answer it. And the first questioner, Gary, is who?
I'm looking for hands. I got 2 screens up here, so I got to keep toggling back and forth.
I believe Kevin was going to have the first
Yeah.
question, Gary, if he's ready.
Yeah, can you hear me, guys?
Yes.
Again.
Can you hear me?
Yes.
Okay. I'm here with Dan. Yeah, I had the question that actually Erhard mentioned it. I read somewhere that if you are over 65 and you drink one, can you hear me okay? One glass of wine.
Kevin, we're getting an echo.
That can reduce your chances of getting dementia. Getting echo?
Okay.
Okay, so dementia. But if you drink 3 glasses of wine, you're going to increase your chances of dementia. So which is true?
In that area, the truth keeps changing. From every so often, something else comes in, which gives us new data. The official word in the medical community now is for men, no more than 2 glasses of wine a day. For women, no more than 1. And that's primarily associated with increased cancer risks and dementia. It's an interesting finding there because men have an enzyme in their stomach which slows down the absorption of alcohol. So we can say, well, we can hold our liquor better. Whereas women and for instance, First Nations people don't have that enzyme in the majority of cases. They absorb alcohol much more quickly and therefore feel the effects more. So a lower rate of consumption is recommended. But I think we're a long way from having rock hard knowledge about that. It's based on one person's experience, another person's. We don't have gigantic studies of thousands of people followed up over so many years that proves that. So stick with 2 glasses a day and you should be okay until the next news flash comes, which could be 3 glasses or 1.
Next.
Jim, you want to go ahead and unmute yourself?
Jim Sordis.
No, Jim McDonald, I think.
Oh, Jim McDonald.
No? Jim, you're still muted.
I wasn't asking your question.
There we are. Am I on?
Yes.
Yes.
Okay, my question is, with dementia, people appear to lose their short-term memory, but the long-term memory is pretty intact. Why is that, or how can one enhance the short-term memories?
Yeah. Short-term memory is developed in a current context. There was a car accident, or you learned something on TV or whatever. And that is formulated and held in one part of the brain. It is then transferred to the hippocampus, where long-term memory is stored, and it's laid down as a chemical process there. As your brain ages and you don't look after it, the ability to move it from short-term memory, which is very brief and then you lose it, to the long-term memory storage, that ability can get lost. So you might go to visit your mother or grandmother in a nursing home, and she'll remember every little detail about when she went to grade 5 and what the teacher said, but she won't remember what she had for lunch that day. So once the long-term memory is laid down, it's there for a long, long time, and it's the last thing you lose if brain function declines because of dementia. Short-term memory is interrupted because the transfer from the one part, like the amygdala, to the hippocampus doesn't occur, or is very impaired.
Thank you.
Dan Gallagher, do you have a question?
Yes, I do. Dr. Busi, so you're talking about long-term and short-term memory. It's I have a problem where I can't remember people's names. I'm in my mid-70s, and everybody is, what's his name? What's his face? So why is that? And does that mean I'm on the road to dementia, or is that just part of aging brain? And I got to tell you that I can't remember people's name with a passion.
It's not a simple answer there. Like, some people are that way all their lives. I'm a bad name remember, and I have to make a mnemonic in my mind or keep notes before I go to a place where I'm supposed to know the people. Now, again, I remember you, Dan, because I see you often. But other people's names I struggle with, and I was just made that way. In other people, it's, again, declining short-term memory. That's the issue. So it's probably not just names. It's probably a few other things as well. And it's so common that people simply develop mnemonics or little tricks of the trade to remember names. So it's not the beginning of Alzheimer's.
Any more questions? Stan, did you have a question? Go ahead and unmute yourself.
Oh, I am unmuted. Thank you. I'm sorry to ask a question, because as you, sorry, I resolve to keep my mouth shut, because I asked too many. But Dr. Gerhardt, from what you've said earlier, which is really fascinating, there's a question I have to ask you, because at the moment you're the only person I think I can ask this to. And it's really related directly to COVID-19 and the effects which various people are having, at those who have been infected and recovered from it. And the fundamental question is, in your experience, is the epithelial system a major system of the body, throughout the body, and one which perhaps is being mainly directly affected by the COVID-19 virus? And the result is that they're having so much trouble in diagnosing people with things going wrong, because it doesn't really, as long as you've got that enormous system throughout the body, it perhaps doesn't really matter where the COVID-19 virus strikes. Does that make any sense?
Okay, let me qualify. I'm not an infectious disease specialist, but I have general knowledge of in these areas. COVID-19, there are daily news flashes. We haven't even begun to fully understand what it does. So, and our society loves headlines, right? So if somebody comes up and a reporter catches it, that becomes a headline. Uh, it, it depends who you are, what age you are, what your comorbid conditions are. In other words, if you have other health conditions. So it affects elderly people, as we know, very differently from students at school or university. Half of them probably don't even know they have COVID-19. They're asymptomatic. And so they have no effect, it seems, at all. But I think it'll be another year or two before the book is written on COVID-19 and whether it has specific effects. Uh, Many people, elderly, who get COVID-19 have numerous other conditions. They may have high blood pressure, they may have had a heart attack and had a stent put in, etc., etc. So it's not just COVID-19, but the effect COVID can have on these collateral health conditions, which can cause problems. So if you ask that question in a year or two from now, we'll give you a very detailed answer. Right now, it's a moving target with news flashes coming in all the time.
Thank you very much. I appreciate it.
Any more questions? Oh, Derek, go ahead and unmute yourself. Oops, you're still muted.
Unmute. Okay, I'm in. I wanted to ask a question about people who seem to have photographic memories. Is that a case, do they actually have photographic memories? I guess that's one. Or is it a case that you mentioned earlier that if you're really interested in something, you really, really do remember it and make the effort?
Two-part answer. Memories are laid down by a combination of the facts that you want to remember and the emotions you had at the time those facts were presented to you. So if you're in a situation where, say you're a reporter, you're in a war zone and you see some life-threatening event, that you will remember for a long, long time, because it's not just the event, but it's the powerful emotions. And it takes the emotions to lay down this long-term memory. People who have photographic memory, some people just are hardwired that way. And we probably have all come across one or two people who have just unbelievable memories. And my guess, pardon me, my guess is, as we learn more about what gives idiot savants this huge skill, we're going to find out how normal people like you and I can also someday develop this tremendous skill of remembering every little detail of a scene, which now we can't. So it's a field that's being researched in about 3 centers very much these days. The results aren't out yet, but we think there's a great thing to be discovered.
Okay, thank you.
Milberg?
Milward, you want to unmute yourself?
Can you hear me? Milbert Giles.
Yes.
Yeah.
Is there a hospital or in our area that's more advanced for the recovery of the methods that you talked about for recovery of strokes?
I don't know the answer, but it's not that hard to find. I mean, I would have to call the head of neurology, say at U of T and McMaster and maybe Western or Queens, and ask that question, and they would know the answer. Certainly, it's a rapidly evolving field of knowledge with great results, but it's so new that everybody isn't fully on board yet. So the answer's out there. I don't have it.
All right.
Tom, did you have a question?
Hi, a very interesting presentation, Doctor. It really hit a lot of things that we are querying about. But the previous questioner was about the photographic memory, and obviously, having photographed for 70 years, I actually can remember if a picture comes up, whether I took it or not. It's just something that comes together because you have certain elements that you think about when you're taking a picture, whether it's lighting, posing, information you're trying to present. But the other thing is there was a picture in the Spectator a couple of days ago that I guess I took because it had my credit line under it, but I don't at the moment remember it specifically. It was Pierre Trudeau and Vic Cox. It was around 1970 thereabouts, and it was used on a sign, one of these sign signal boxes that they're having around Hamilton now. They put a photograph on it of maybe a little bit of history. So there are some things about photographic memory, I think, that do work. And again, I really appreciate your presentation. Thank you.
There's actually, do I have a moment to amplify?
Yes, go ahead.
Okay. Interesting studies have been done, and they're worth mentioning very quickly. I'm aware of time constraints. We all know, any one of us who's had more than 2 children knows that kids are not born the same. They're all born with very different hardware to start with. And to study that, a couple things were done. People were put into a completely black room. There was nothing they could see. It was completely dark, so there were no points of reference. They were given 2 joysticks and told, feel the table to the left of you, there's a piece of wood there. Feel it, thickness, length, height. And then using joysticks, which control 2 dots on the black wall in front of you, show me how big that piece of wood is, how long it is, how thick it is, how wide it is. And what they found is there's a huge variation if you do this to a number of people. Some people are called reducers. They saw the piece of wood as a little tiny thing in this black room with no reference points. And some saw this piece of wood as a really big thing, the augmenters. Artistic people belong to the augmenters. So photographers belong to the augmenter group who just, things have a bigger impact on them. The middle linebacker of the Chicago Bears, for instance, he would be a reducer. You know, you break a leg and bash him up and ask him if it hurts. He says, well, a little bit, only when I laugh. So we have a broad spectrum of how we experience things, and that aids us in laying down memory. The second study, very interesting, was done by a female psychiatrist called Stella Chess. She started working in the 50s, and until then, Freudian dogma was that kids were born as a blank sheet, and then the environment would write things on that and make them who they are. Now, again, if you have kids, you know that's not true. Kids are born different. And what she did is she studied people and followed them up for 30 years to see whether very early responses predict how you turn out later on. And she found that this was deadly accurate. And she, being a child psychiatrist, divided people into 3 basic categories. There's the easy child. That's the kid, no matter what happens, they just go with the flow and they land on their feet. And we all know some adults who are like this. Things just turn out for them. Then there's the slow to warm up child. And these kids don't like change. And as adults, same thing. But once they've adapted to change, they do really well. And then there's the difficult child. And these are the people that push rocks uphill all their lives, right? They go through 8 or 10 to 12 different jobs, 3 marriages, and on and on. And she could identify those characteristics at birth or within the first few weeks of life. And they became accurate predictors of what we would turn into around age 30 when her study ended. So think about yourself, decide whether you're an easy child, slow to warm up child, or a difficult child. That's it.
Thank you. We'll take one more question if there is one, Gary.
I'm looking for hands. I'm not seeing anything, Jim.
Okay, thank you. So the formal part of the meeting will now be coming to a close, and on your behalf, I want to thank Erhard for his stimulating and engaging presentation and for using my aging brain and some of the examples and anecdotes that he used, especially about my two children. And I also want to thank Kevin Harrar for hosting Erhard this morning and in his house. And the two of you can now go back and enjoy the breakfast that was probably interrupted when you started the presentation. And to our members present, thank you for attending today. This session has been recorded and will be uploaded to a YouTube channel by Bob Lalonde, our Fearless Communications chairman, within a couple of days, and you'll be notified when it is loaded. It's interesting to see that the number of people logging into that YouTube presentation the last couple of months was about 3 times the number of people attending the regular meeting on Zoom. So having that seems to be a very valuable addition to our presentations. After we conclude the formal part of the meeting, we're going to move into breakout sessions as we have in the past. And I encourage each one of you to remain for that. The formal part of this meeting is now ended, but as I say, please stick around. The date of the next meeting is Thursday, October 21st, and you'll be notified again on how to connect.